Welcome back to the show, folks. The very first doses of a long-awaited coronavirus vaccine are being administered across the United States. What an incredible sentence to even say. And as the Pfizer vaccine rolls out, the FDA could also authorize Moderna's candidate as soon as Friday. Earlier on Cheddar, we spoke to U.S. Surgeon General Dr. Jerome Adams about this turning point in this pandemic.
2020 has been a marathon for sure. And for any of you who've run a marathon, you know that the last couple of miles are the hardest, but it is easier to finish if you can see the finish line. And unlike the first surge or the second surge, we're in a terrible third surge, but we actually know that there's a finish line in sight.
Still so much more to be done, but one big thing to celebrate. Northwell Health is marking a major milestone in its fight against COVID-19. It was the first in the United States to immunize frontline healthcare workers on Monday. These images yesterday, you probably saw them at its Long Island Medical Center. Joining us is President and CEO of Northwell, Michael Dowling. Michael, great to have you. Congratulations there. You were there inside the room as this actually happened alongside Sandra Lindsay. You were in Queens. First of all, what was it like to be standing there? There you are in these iconic images. Michael, the entire world was watching this live as this happened. Everyone seemingly in the United States taking a long-awaited sigh of relief. What did it feel like to make history as the first hospital to give out the very first COVID-19 vaccine here in the United States?
Well, it was an extraordinary experience, and you could see it in the smiles and the eyes of the staff who were just walking around, and you could see that they were thinking, there's a light at the end of the tunnel here. This is a landmark event. This is historic. We've worked very, very hard over the last 9 months dealing with extraordinary circumstances, and it's going to continue for a while. But now that we have the vaccine, we know that it is the medicine that we need to get to the end of this COVID situation. So it was about hope. It was about delight. So it was extraordinary to be in that room and to watch the staff. And then I walked around the hospital afterwards, and I was, a euphoria, obviously tinged with a sense of reality because they're still dealing with COVID patients and with other sick people in the hospital. But it was, you have people saying to me, well, we now know that at some point in the near future we'll be going back to normal, and that this will be behind us and it will be part of history. And this time next year, a year and a half from now, we can talk about what did happen rather than always talking about what is going on and what is happening today. So just a great experience, and I can't say enough about the wonderful staff that we have, and those are the people that are the real heroes here, and I'm so happy for them. That they know that they will get a reprieve from something that none of us have ever experienced before.
There are not enough words in the English language, Michael, by which to say thank you and to express our gratitude to those staff members, your colleagues that you just talked about. But let me allow to try myself to say thank you so much for the service in this incredible moment. Michael, you referred to this as D-Day, or excuse me, V-Day, V-Day.
Yes.
What does this moment mean? What does this day mean in terms of this incredible place and time we are in terms of science and humanity?
Well, I think there's a lot of things that you can celebrate here. One is that we were able to develop a vaccine very, very, very quickly. Two is that despite the fact that we didn't have a vaccine for the last 9 months, what the staff did to save so many thousands and thousands of people was pretty extraordinary, and that is something we should also celebrate. Obviously, we're hurt by the fact that people did pass away and die, and people got very, very sick, but thousands of people were saved. It also rejuvenated healthcare. It demonstrated the essential nature of healthcare workers and the role that hospitals play in our local communities. And you walk around and with this sense of extraordinary pride in the business that you're in. I mean, all of the people that get into healthcare go into it for a reason. And what we've been able to do up to this point has been extraordinary. But now we have an extra medicine, as I just mentioned. And what we'll be able to do in the future will even be better because we've learned many, many, many lessons here. We've learned how to come together, how to unify, how to work together in extraordinary ways, how to be resilient and how to be tenacious and how to have extraordinary courage. And if you can transmit those into the world that we will be in, obviously, post-COVID, then I think we can dramatically improve the way we deliver healthcare. And of course, COVID did, on the other hand, demonstrate some gaps that we have, inequities in healthcare, et cetera, that were clearly demonstrated here. And we obviously have to work on that going forward. So I believe it changed our perspective. It changed our experience. It changed how we look at one another. It changed the way we look at our industry. And I hope going forward now nationally that we re-energize ourselves to build a better sense of community nationally, and that we've come together as a country, unify and move forward with a sense of positiveness and hope. And that's what it's all about at the end of the day, is getting up in the morning, getting up at the beginning of the week and say, this week is going to be a good week. So I look forward to the next couple of years and say, these are going to be good years. We're going to make real progress in the future.
Michael, give us a sense on the number of people that have so far been vaccinated, what that distribution strategy is going to look like in the crucial days and weeks ahead. And your sense on, I think, a question that a lot of people have, and understandably so. People are asking, okay, well, when might I get it? When might people in my family be eligible to receive the vaccine? How do you expect those questions will be answered in the months ahead?
Well, it so much depends upon the volume of the vaccine that we receive each week and each month. So right now we have been vaccinating today. We will do hundreds and hundreds of people today. We will intensify that over the next couple of days. Remember, only some of our hospitals got the vaccine. Not every hospital got the vaccine. We are getting another delivery tomorrow, and we will get more deliveries next week. So as the volume and as the deliveries come in, and I don't know exactly the number of doses that we get each week, so we will have to adapt and be flexible. So for the next couple of weeks, we will be vaccinating emergency room workers as well as ICU. And then we will, beyond that, going into the end of December, the beginning of January, we will be vaccinating the rest of our workers. And in our case, direct care workers that deal with staff is 55,000. My guess is that we will conclude that, depending on the volume of the vaccines coming in, by somewhere in mid-third week in January. At the same time, of course, the Moderna vaccine is coming in, and that will be targeted to deal with nursing homes. And that's being done by Walgreens and by CVS. That's going to happen hopefully over the next week or so. We will also be involved in that as a partner with them. So my guess is by the end of January, we will have the nursing homes done, the healthcare staff done for the most part. And then we will be moving into more of the high-risk individuals and other essential workers, firemen, policemen, transportation, etc. And by the time we get to, I believe, the end of the spring, let's say May, June period, my guess is that we would be close to getting to the general public, the so-called, quote unquote, healthy people. Remember, this is a good 6 to 9 month process. It's not a quick fix. And the thing that I have emphasized over and over again when I talk to people about this is, while the vaccine is fabulous and wonderful, we still have to wear the masks. We still have to social distance. We still have to not have large groups. We've got to watch what we do at Christmas, during the holiday now, where we have to watch, especially what we do on New Year's Eve. Everybody has this tendency to want to go every place and just celebrate, and you can obviously imagine why people want to celebrate in a new year and try to forget the one that we just had. But if you do it in large groups and you don't wear masks and you don't social distance, then you're going to prolong COVID. So the medicine here is the vaccine plus compliance with safety measures. If we do both, then we will be in a good position, I believe, in a better position by the end of the summer of 21.
Michael, unfortunately, we need to leave it there, but you took my last question, and I'm glad you answered it, which is, What do you still advise people to do? These mitigation strategies are not going anywhere just because we have reached this historic moment. But Michael Dowling, we have reached this historic moment. It is a checkpoint in this once-in-a-lifetime challenge. And my special thanks to you and your colleagues there at Northwell for all the work you've done and all the work that the American people are still relying on you to do in the very difficult months ahead. Michael Dowling, President and CEO of Northwell.
Thank you.
Thanks a lot for being here.